I felt very privileged to be in Ireland for the launch of the Delivering Change Together programme. And one of the things that I really love about the programme is how it brings together organisational development, programme management, focus on action learning and quality improvement, all working together in such a powerful and integrated way. And I'll remember this for a long time.
I'm really pleased to be here today as we're launching the Experiential Change Programme here in Sligo. And it demonstrates how collaborative working between local, regional and national services can really deliver. This particular initiative grew from conversations between the 3 partner organisations, including Community Healthcare West, Saolta Healthcare Group and Community Healthcare representing Cavan, Donegal, Leitrim, Sligo and Monaghan, working with ourselves in national organisation development, change and innovation. Integrated working between development partners can really make a difference. Our role is to serve the system. So we really hope that this is a practical and a very relevant offering that can support local managers, local services who are grappling with very challenging change challenges and trying to bring about service improvements as they grapple with the challenges of delivery of health and social care services. It will also be a key enabler for the implementation of the regional health areas, so the timing is very opportune. And this programme will continue to support people who are delivering integrated health and social care delivery to improve services for patients, for service users and for local communities.
This has been really a personal journey for me. I live in the locality. I've worked in the region for the 3 organisations that are coming together. This is about, being able to give back to, the relationships, the connections, the people that I've worked with down through the years. And what's really exciting me about the Experiential Programme is there is a lot of really good people, leaders in the system that are going to affect a huge amount of service change right at ground level for the people that we serve, for our communities, our families. And they're all coming into the room tomorrow, going to develop these communities of practice. And what's also really exciting me is that our 3 leaders in the 3 organisations are really wanting to lead this and wanting this to really happen. And because of that, there's a really ground-up, top-down approach to these communities of practice. And I've been blown away by the enthusiasm, by people wanting to be involved and wanting to be engaged. That's really what the whole programme is about. It's about building the network, building the connection that's going to drive the change of Slaintecare. So it really will make a difference to people's lives.
I'm really pleased to be here this morning at the Conference for the Change Development Programme, and I'm really pleased to be co-sponsoring it with my colleagues Breda Crahan-Roche from Community Healthcare West and Dermot Monaghan. Jertharing Gaelga gur Tusma Yahna Hebra, and a good start really is half the work. But even though we've been working hard to implement the Slaintecare strategy since 2017, this morning's conference marks a really important watershed for everybody that's attending. It's about starting the process of implementing the RHAs. Everybody that's attending and involved in this change management programme will benefit from the support and the learning from each other. I really hope we have a good start here this morning. I'm looking forward to it.
I'm delighted to be here today participating in the change management programme. In my role as quality improvement for paediatrics across the Saolta University Healthcare Group, I see myself as someone who will be helping to lead change within the children's services, and I hope to take with me some useful tools in order to be able to help me to assist my colleagues throughout that change process, whilst keeping the patient at the centre of everything we do.
The opportunities that have come out of this programme for people are immense. It has given them a voice, it has given them an opportunity to say what they need in terms of change and project management experience. We've been able to draw on the national resources that are available to people, that they may not have known were available, and we've also been able to integrate to look at common needs between the community and the acutes and to see really what matters to people and where they need help. This programme will be spread over the course of a year. It's not just a one-day programme. It's going to address a lot of needs for people. They're going to be better informed, they're going to be more confident, they're going to be more assured, they're going to have signposting, and they're going to have people, both their peers and people in their local PMOs and at national level that they can go to and that they can address further questions in relation to their needs. So we expect that people will come away from here invigorated, enthusiastic and ready to go.
It's an absolute pleasure to be here today for what is a very inspiring event. It is wonderful to see so many people from across the organisation here today, and in particular to see collaboration between the National Change Team, the National Quality and Patient Safety Directorate, NMPDU, the Chief Officers and so many more, the Project Management Office coming together, because for most people there are so many different methodologies for making and doing the work that we do successful and making sure that it's working for the patients and service users in our organisation, but they don't really mind whether they're using project management, they don't mind if they're using quality improvement, they just want the right tool at the right time. And to see something like this that allows us to collaborate effectively so that the people working in our system can access the tools they need to do the job that they need to do is hugely powerful. I think when you look at a day like today, you see people giving up their time, you see the enthusiasm and the excitement in the room about making that difference, and also that recognition that every single person here today and the colleagues we work with are the professionals at what they do.
I'm delighted to sponsor this Change Practitioners Experiential Programme. This is an excellent opportunity for staff to network, share experience and learn from each other through practice and shared purpose. As Chief Officer of Community Healthcare West, this will build on our work to date and learning over the past 3 years. This programme will augment implementation of the Enhanced Community Care, Integrated Care Programme for Older People, Chronic Disease, Community Health Networks, implementation of progressing disabilities and mental health services. This programme is about bringing staff together, utilising evidence-based international practice through the HSE Change Guide, project management and quality improvement methodologies. Change needs support. We need to be prepared, be flexible and agile. Today marks an important milestone in the commencement of the RHAs and change management. It will provide an opportunity for staff to collaborate, working across community services and hospital groups, to collectively work on common goals and objectives.
I was delighted to be given the opportunity to attend this change management programme today. So far I've found the day very inspirational. I've learned a lot. I suppose my real hope is that we can really drive forward true integrated care across the community so that for all of us we can experience a healthcare system that really delivers coordinated, cohesive, integrated care for all of us.
It's wonderful that the partners are coming together to support the communities of practice in a meaningful and hands-on way. Each of the communities of practice will be supported by a convener who are subject matter experts in their own field. Ultimately, this is about creating a condition for service integration and RHAs. I'm delighted to be involved in this process.
I'm delighted to be here in Sligo attending the Communities of Practice session. In terms of regional health areas, it's really important that change comes locally, and I really welcome the work being done by the Community healthcare organisations and Saolta, supported by the Organisation Development Unit of the HSE, to make that change local for the people of the West Northwest. So well done and congratulations, and hopefully it's a real contribution to change for the future for patients and service users.
As Chief Officer of Community Healthcare Cavan, Donegal, Leitrim, Monaghan and Sligo, I feel very enthusiastic to be sponsoring this programme. It's a very valuable initiative that will be instrumental in enabling the future functioning of the RHA. I'm delighted that we have representation here from staff working across various programmes, including disabilities, older people, primary care, enhanced community care and digital health, to name a few. It reflects the shared ambition to integrate care for patients, built on our work with each other. This programme is all about integrated working across the two CHOs and the hospital group that will form this local RHA, with future work for our CHO into the East RHA. It will act as a cornerstone to enable us to build a fully functioning RHA that is grounded in partnership working. This programme will give participants the tools they need to work together on common goals, share information and put into practice problem-solving techniques to achieve tangible results. And the old adage of 2 heads are better than 1, 2 or 3 heads from relevant specialities are better at solving our many health challenges. It is vital that we create a safe, shared learning space whereby we can build upon our collective knowledge of what is working well and what needs improvement.
Great to be here today to meet colleagues from different areas, different regions. Great to work with our colleagues in Saolta and Community Healthcare West to help find common solutions to our common problems, and I think that's one of the big things I'll take from today.
Delighted to be here in Sligo today at the launch of the Communities of Practice. As a convener today, I hope to be able to establish close working relationships with my colleagues within the HSE.
I think today is a great opportunity to allow services across the western seaboard to come together and look at how they can work together to create capacity for change to lead out on the RHA implementation. It's been a great opportunity to see our senior leaders from both community and acute coming together and speaking. I'm looking forward to working with both national and local services to support them in the change implementation that's ahead.
It's wonderful to come together to build the skills for integrated care.